Welcome, my name is Angie M. I am a research manager here at Healthcare Ready. We're so excited that you can join us for this next hour on the topic of communicating the business case for supporting emergency preparedness. This webinar is being presented by Healthcare Ready and in partnership with the Association of Clinicians for the Underserved, and it is made possible through grant funding from Centene Foundation for Quality Healthcare. Just a little bit about the program under which these trainings are made available. The ARCHER program, or Advancing Resilience for Community Health and Emergency Response, is a program launched in 2022 by Healthcare Ready, all about creating emergency preparedness trainings, supporting resources and materials for FQHC staff and health center staff to be better prepared and be better supported as we go into the disaster season coming forward. All of our previous webinars and trainings, resource materials are available on our website. You can go to healthcareready.org/resources/#community. We'll write that out to have access to any of these materials. And they're available for absolutely free. Made possible again through our funding from Centene Foundation for Quality Healthcare. A little bit more on ARCHER objectives. The objectives for the ARCHER program is really to build capacity, train, and provide technical assistance for both providers and operational staff and clinics on topics related to emergency preparedness and response. We are looking to build and deliver trainings that are both nationally relevant and specific to regions. So if there's any kind of information or education that you are looking for to support your clinic or your members within your health plan, feel free to reach out to us anytime. We're happy to work with you on that. Again, Healthcare Ready is available to support you in many ways, disaster season and in between events. You can always sign up online for our situation reports through healthcareready.org/contact us. And if you'd like to send us an email, have questions on other services that we may be able to provide to support you and your centers in being better prepared, feel free to reach out to us at alerts@healthcareready.org. This conversation is meant to be a conversation, so please don't hesitate to write your questions, your ideas, your experiences in the chat. If you would like to come off mute, feel free to raise your hand and we'll go ahead and make sure to unmute you so you can speak directly. Without further ado, I'm pleased to introduce our two guest speakers today. We have Molly Melbourne, President and CEO at Southwest Community Health Center, and Tom Cotter, our new President and Executive Director of Healthcare Ready. Just a little bit about their backgrounds. We're so pleased to be able to have Molly here today to speak with you. She is an expert on all things emergency preparedness for community health centers. She comes to us having previously worked with the National Association of Community Health Centers as the National Director of Emergency Management, where in that role she was able to develop, implement training and technical assistance offerings related to emergency management. Tom Cotter, he joins us. Joins us in his very first few weeks here with us at Healthcare Ready. He comes to us with more than a decade of global health readiness and response experience, expanding nonprofits' work to address health equity. He has over a 15-year career in public health and emergency management. He's piloted and launched innovative international strategies to localize emergency response operations and build sustainable response functions worldwide. And he has very strong experience, or deep experience, having built up clinics around the world. With that, the agenda for this conversation today, we're just going to spend a few minutes on Healthcare Ready and an overview on the health services that we provide. Tom will share a little bit to disaster trends, what we're seeing in the current landscape, what we're hearing from community health center staff, and what leaders should be prepared for in responding to the future. Then we'll pass it off to Molly to speak to building the business case for emergency preparedness. So all about strategic planning and speaking to your leadership about building the business case for emergency preparedness investment, ways to think through how to incorporate planning and strategic support for emergency preparedness for your community health centers. And then we'll follow with about 15 minutes of discussion at the end. Don't wait till the end to share your questions and comments. Feel free to jump in the chat. With that, I'm happy to pass it off to Tom.
Thanks so much, Angie. I will be relatively brief so that we can use Molly as much as we can in her expertise, and I am the only thing standing between you and learning a lot about the business case for disaster preparedness. By way of introduction, Healthcare Ready is a nonprofit organization based in DC, and we stand at the intersection between government, private sector, and nonprofit entities as it relates to health equity and healthcare supply chain. Of course, that made us very popular during COVID-19 and even currently with a lot of healthcare supply chain issues. We have a lot of different services and products, and again, I would invite you all to visit our website and take a look at them, hopefully some of which will be useful to you. But our main focus is to develop those collaborative partnerships to alleviate, prepare for, recover from, and respond to any disruptions to healthcare access to folks that need it the most. I'm really excited I was really excited when I found out what topic this was, and Molly and I were chatting a bit beforehand. This is a really important topic, as we know. There's no real argument about whether or not emergency preparedness or disaster preparedness is important. What I think is really interesting about specifically having Molly here, and again, I'm only a week and a half into the job, so I'm kind of coming in cold to a lot of this. Molly's not a FEMA representative. She is not a consultant, coming from a government contractor. She's the CEO of a community health center. And so coming in with that lens, I think brings a certain level of understanding of what a resource-constrained environment is like, which we are all working in, all of us on this call. And to kind of sum up where we are right now and where we're going, this has been a very long 2 years for everybody. There isn't a single person on this planet, including on the continent of Antarctica, that hasn't been affected by this. We have undoubtedly stretched our already fragmented and under-resourced healthcare system, especially safety net clinics and community health centers, to their absolute breaking point, and some did break, right? So we're coming out of this really limping, and we're still under-resourced. I don't think there's any argument that, let me know in the chat if you are perfectly resourced and you need no additional resources. I want to know how you're doing it. But that looks like it's going to remain the same. We have the same amount of resources with a lot more demands on us. Not only are we preparing for our usual day-to-day operations in primary, secondary, and tertiary healthcare, depending on your unique facility, but we're also leaning into needing to prepare for climate change and what that means for the populations that we serve. We're needing to think about how we're allocating resources towards our planning and preparedness, how we communicate that to donors, to our supervisors. On this call today, we have everybody from a CEO all the way down to clinical providers, because we think that this is an important way, an important lesson to learn on how we communicate the absolute imperative to allocate resources to preparedness. We're dealing with a lot of staff shortages. That's just one aspect of this. We learned from COVID-19 that the resiliency of our clinical providers and our business continuity plans need to be in the forefront of our thinking. And it will not be as easy as gathering volunteers anymore, or being able to recruit nurses. And we know this because we know what travel nurses were making during, what a good time to be a travel nurse. What an unfortunate time to need nurses at a community health center. And so baking some of that into our understanding of it. And at the same time, outside of COVID-19 and monkeypox and whatever else is coming down the pathway, we're dealing with more frequent disasters. So some of us experience disasters of the weather variety, whether it is winter storms that are more frequent, whether it is heat emergencies, whether it is hurricanes, tornadoes, and the like. Those aren't going away, those are increasing. And this is, again, all in the context of not receiving enough resources that we would require or want to be able to build really robust systems. And so we're having to triage our resources, and that's all the way around. And so this is a conversation for us to talk about how to think about this, how to communicate this need, how to triage those dueling priorities, because everything is urgent all the time when you're a safety net clinic and a community health center. So I'm really excited to hear from Molly. I'm going to not have any more ado because I'm really interested in this presentation and really excited to hear her perspective from someone who's worked in many different aspects and facets of this field, in addition to being an expert in this space as well. So without further ado, Molly, thanks very much.
Tom, thank you. Really appreciate the opportunity to have this conversation. It's been a long time since I've been able to talk about two of my favorite things together, community health centers and emergency management or emergency preparedness. So I had to start out with a little something about where I sit for far too many hours every day. As mentioned, I am with Southwest Community Health Center. We are located in Bridgeport, Connecticut. We're about an hour and a half east of New York City. We have 21 locations and are growing. Even despite the challenges that we're facing, we're recognizing the need to increase our footprint around the city of Bridgeport. We serve somewhere around 25,000 patients, and we have just over 300 individuals who work with us at Southwest. I wanted just to give you a little background on who I am. I've been here just about 3 years. It was a heck of an introduction to running a community health center. As soon as COVID hit, things changed very quickly. I was previously at the Connecticut PCA, that is called the Community Health Association of Connecticut. I had the pleasure of serving as the Chief Operating Officer there. And as mentioned, I spent 7 years at NAC, 7 wonderful years at NAC. While I was there, I had the opportunity to work with health centers who were managing their response and their recovery from things like the 2007 wildfires along the west coast of California, hurricanes, of course, Superstorm Sandy, tornadoes, including the Joplin, Missouri E5 tornado that came through, mini floods, and H1N1, which at the time seemed absolutely overwhelming. Now I would take H1N1 in a heartbeat compared to what we're working with now. So we've already talked about the agenda, but I added one thing. I want to very briefly talk about definitions so that we all are operating from the same page. You'll hear emergencies and disasters interchanged quite a bit. And at the end of the day, it doesn't really matter as long as you're working towards your preparedness for response and recovery from some sort of incident that happens in your area. Technically, an emergency is something that is really local. So it may happen just to your organization or just to your community, and you can manage it with your local resources. So whether they're internal resources at your health center or local police, local fire, local EMS, local DPH, you can handle them with the resources that are around you. A disaster is more widespread, so it's the next level up. And this is something that you will manage with local, but probably also regional resources. Regional could be county, if you're in a county system, could be your state, could be other states around you, could also be national, but the event doesn't rise to national significance. certainly significance in your area and your region, but it doesn't affect everyone across the country. A catastrophe, however, does. And certainly COVID is a perfect example. Not only does it rise to national significance, it clearly rises to international significance. Other ideas for things that could rise to the same level would be a terrorist attack or nuclear accident. So there are differences, certainly from an emergency and disaster to a catastrophe. And we generally talk about emergencies and disasters, but we also need to think about catastrophes as we're going through the preparedness process. After the last 2.5 years, that's pretty much all we can think about and talk about. So we'll spend a moment just talking about the phases of emergency management. I'll reference them later, but again, just to make sure that we're all singing from the same sheet of music. First stage of emergency management is mitigation, and these are the things that we do to either prevent an event or reduce the impact of an event. These are things like in areas that are prone to wildfires, making sure that we have cleared the outside of our buildings from vegetation, that we have that barrier there so that if they catch on fire, they won't necessarily catch our building on fire. The second phase is preparedness. That's what we're talking about today. These are the efforts that we undertake to plan for an event and train for that event to make sure that our plans actually work when we need them to work. Thirdly is response. That's what we do immediately following an event. And then lastly is recovery. And some of these are going to go sequentially, others will be happening at the same time. So recovery are the things that we do to get back to some definition of normal as quickly as possible. When I talk about normalcy before COVID, we did think about coming back to exactly where we were before the event. I think after COVID, our definition of normal has changed. But these are the things that we need to undertake generally concurrently with the response so that we can get back to the business of taking care of our community. Business continuity is a part of that. Some organizations look at business continuity as more of a standalone effort. I see this as an integral part of all of our emergency management efforts. So this is really focused on the business functions of our organization. Emergency preparedness is all about protecting and saving lives and assets. Business continuity is about getting back to the business function of our organization and really making sure that we can provide those essential services that our patients and community needs. I will go through this very quickly. Hopefully this is not new information to anyone. A lot of these have been around for a while, but as federally qualified health centers, HRSA does have some expectations for us. They published these quite a while ago in 2007 and have largely remained something that we have talked about over and over again. So the Bureau expectations include emergency planning. So they expect us to engage in a process that incorporates those 4 phases that I just talked about. It gives us the opportunity and the headspace to really define if we're going to respond to a particular type of event and how we will respond, making sure that we focus on our patient population and any other special populations that may be in our immediate area. They also expect that we will do this with partnerships, and I think that that is critical. None of us can respond to a large-scale event without help. COVID is that perfect example. None of us could handle this within our organization or within our community without a lot of support and a lot of partnership. These conversations also should happen before an event occurs. There's a saying that is well overused in emergency management efforts, but it's that you should never give out your business card at a disaster. You should already have these relationships in place. You should have already had the conversations about your role as a community health center within the overall response within your community. Communication, that is often the thing that trips us up the most in responding to an emergency. In real estate, it's location, location, location. In emergency management, it's communication, communication, communication. So this is the phase that we really need to figure out what we need to say to whom, when, and how. Lastly, it's maintaining financial and operation stability, and that's really speaking to the business continuity aspect of emergency management expectations. A few years ago, CMS didn't want to be left out, so they came out with preparedness rules for those healthcare organizations that receive Medicare and Medicaid reimbursement. So we can all raise our hands as having this applied to us. Again, these are very much the same expectations. They're just organized a little bit differently. So for them, the core elements include risk assessment and emergency planning, and making sure that everything we do is an all hazards approach. So we're not focused on just one kind of emergency. Secondly is ensuring that we have the policies and procedures in place so that we can execute that plan, that it involves risk assessment and communication, which is also the third core element, to make sure that we comply with federal, state, and local laws. I'm not exactly sure what that means in the context of communication, but certainly our response should comply. And these are things that we need to do every couple of years. We need to make sure that we have trained our staff and tested. The last place you want to discover that your plan doesn't work is in the midst of a disaster. And lastly, not one of the core elements, but for those health centers that are part of a larger integrated health system, making sure that you're planning across that system and not in a silo. OSHA came out with a temporary standard in 2021 about COVID-19, not surprising, making sure that we have plans, that we engage in infection control activities, which we all were anyway, that we train our staff on COVID-19, how it's transmitted, how to protect ourselves, and lastly, that we keep records of what's happening with our staff in terms of COVID infections. And then undoubtedly, you are all very familiar with the CMS interim final rule on vaccination. That has been something that has taken a lot of effort on all of our parts to make sure that we have appropriate plans in place. The effective date of this is a little complicated depending on where you are. And this requires, as you know, health centers to develop and implement a policy and plan around ensuring that our staff, board, and folks that come into our health center regularly are vaccinated for COVID-19 and may allow us to accommodate those with medical or religious exemptions. For those of you like Southwest that bring this on yourself, of course, the Joint Commission also has emergency management standards and a number of elements of performance. Again, these are really the same as what the Bureau and what CMS has put out, just organized differently. But I think it's really important to note that if you do one, in large part, you're doing the others, but you need to make sure you crosswalk it and that you're addressing things in the way that all of these entities require you to address them for compliance. All right, so now on to the more interesting stuff. I just can't talk about this without making sure that we all are on the same page about the requirements and why we do this. So the first thing about the business case for this, we do these activities, we undertake these activities, we engage in this process at the end of the day because we have to. If we are a federally qualified health center, these things are expected of us. And one of the things that I used to hear all the time when I would travel around to talk to health centers and PCAs about these expectations is that this is yet another unfunded mandate. I understand that, especially sitting in this particular position, but I actually think of this as an obligation. We have an obligation to continue the services for our patients. We have an obligation to ensure that our staff are safe when they come into our facilities. So to me, this is an unfunded mandate, but we have so many others that this is simply one of the things that we need to do as a community health center. We also know from, can we go back one, please? Thank you. We also know from experience that whether we're ready or not, whether we plan to respond or not, our patients are going to come to us. We are trusted members of our community. Our patients get a lot of their information from us. They have close relationships with our staff and our providers. They will come to us. So we can either be ready to manage whatever is coming our way, or we can fumble and let down our patients, let down our staff, let down our community by not being able to effectively handle the emergency or the event that has occurred. Being prepared will also reduce the impact on our health center. Yes, it takes resources, absolutely, but those resources are well placed. And at the end of the day, they will help reduce the impact on our ability to provide services and the types of services that we're able to provide. It will reduce the impact on our staff. They need to feel safe and secure, and undertaking a comprehensive emergency preparedness process will absolutely contribute to that. We need to protect our facilities because that's obviously going to impact our health center services as well as our staffing. And if we are well prepared, we have a better chance of protecting our property, our equipment, and some of our other investments. All of these things roll up into a reduction in the financial disruption of our health center. Money makes the world go around, and it's no different for health centers. So having preparedness in place allows us to recover faster and either maintain or restore that cash flow. There's not a lot we can do without dollars coming into our health centers. We are going to run out of those funds quickly and have a huge impact on our community and particularly our staff if we can't meet our financial obligations. Many of us also have programmatic obligations from funders. Even during a pandemic, we had some programs that, while they understood that the world had turned on its ear, they still expected us to very quickly reinitiate services that they were funding us to provide. They understood that we were scrambling. They understood that we were trying to figure out the landscape. They still needed those services for their clients because their clients were counting on them. So to say that there's a disaster and you can't provide those services doesn't work in many cases. And frankly, it shouldn't work. What we do is life-saving. So we need to make sure that we can continue those services as quickly and comprehensively as possible. Lastly, and we all know this, non-compliance can really hurt us. It can impact our 330 status. It can absolutely impact our ability to receive Medicare and Medicaid participation. And if we can't receive that reimbursement, we won't exist for very long. And lastly, it can impact our ability to achieve or retain our accreditation from organization like the Joint Commission. So as I was putting this together, I want to not think about COVID. I'd like to put it in a box and bury it in my backyard. But the reality is that none of us can do that. And COVID weighs very heavy in all of our minds. So I started also thinking about the opportunities that emergency preparedness brings, and certainly emergency response. So having an effective response is really key to either maintaining or improving your reputation. Organizations, partners, entities, your patients, your staff, they're going to look to you to mount an effective response. If you're not prepared to do that, it's not going to be successful. So to maintain that reputation, it's really important that you have these phases of emergency management living within your health center. So we really took advantage of COVID to increase our visibility. We would have much rather been able to do that in another environment, but this was what it was. And so we wanted to make sure that people knew about us, that we were able to provide them with the resources that they needed. We launched a very comprehensive testing and vaccination program as soon as we had the resources to be able to do that. We found that all of a sudden, people who had never heard of Southwest knew who we were. They saw our vans driving around town. We got waves and honks and people cheering us on. We had billboards. We had this beautiful mobile unit that we were able to purchase thanks to the generosity of the federal government. And we made sure that people knew about us. We started seeing our names pop up in places on Facebook or Instagram or Twitter occasionally in areas that we never would have expected. People who talked about what we were able to do for them in our community. So it really was a great opportunity for us to increase that visibility during a really, really difficult time. That helped us retain our patients because they felt that we were competent and we were able to provide what they needed when they couldn't get it from other places. It also helped us attract patients. They are still coming in saying, you know what, I was tested at your location for COVID and I got my vaccination at your mass vaccination site. I'm going to come to you because I see that you care about the community and that you have the ability to function even in the face of a situation that is scary and impactful and pretty much overwhelming. It created new opportunities for us, and emergency response will do that. It allows exposure and shows what you can do, and absolutely opens doors that perhaps before, not only were they not open, you didn't know they existed. It also has allowed us to enhance existing partnerships that go well beyond COVID. So the opportunities that have come our way through new and existing partners will extend far beyond even what we're doing now, and will absolutely help to support our community as they continue to seek primary care services from health centers. Lastly, and this is something that we hoped would happen, but we didn't know it would, our donor base increased. All of a sudden, we started getting checks from donors. Some of them were quite large. And these were individuals that saw what we were doing, individuals and foundations that saw what we were doing and felt that it was important to support us. So this is something that we can't discount, because the ability to have that support, and we hope that it will be ongoing, is critical to our ability to maintain operations, to expand what we're doing, and to continue to meet the needs of our community. Lastly, engaging in preparedness helps us to distribute the costs of these efforts over time. We can't do it all at once. We can't afford to do it all at once. But if we can budget for it and spread it out, it really does make a difference. For COVID, for instance, we had already started to build a fairly healthy supply of PPE long before we even ever heard the word COVID. We did that because we knew that there was a chance that an infectious outbreak of some type was possible, and in some cases even likely, based on where we are and some of the things that we've been seeing in the community. So we already had a decent supply. That really helped us weather the storm when you could not get an N95, or you could not get gloves, or you could not get hand sanitizer. You know the story, you all lived it. We were able to weather that. We actually were even able to support some of our sister health centers that ran out of the supplies that they needed to be able to maintain operations. So having budgeted for it and prepared allowed us really to continue without the same amount of attention and energy that was needed to get the supplies that were critical for operations. It also helped us not avoid, but reduce the impact of all the price gouging that was occurring, because we weren't in a position where we had to purchase right away. And certainly what we saw during COVID is something that we've seen in other disasters, not to the same level, but we will see in other emergencies and disasters in the future. Okay, so many of you are in leadership positions, so I might be speaking directly to you. If you are, then of course we have another layer on top of us. So in my mind, engaging leadership is not just engaging the directly employed leadership, but also your board, because at the end of the day, if it's important to the board, it will be important to the leadership within your organization. The first thing I implore you is to find the right ear. Make sure that you're talking about preparedness from the right angle to the right person. So for instance, if you're talking to your CFO about infection control, you're probably not going to get a lot of traction. You need to make sure that you're targeting your comments to the person who actually has the responsibility to implement or maintain those functions. We have all learned way too much about emergency response over the last 2 years. So we need to make sure that we are monitoring our lessons learned, and those lessons absolutely shift. We are not done learning. So make sure that you are documenting and really kind of tearing apart those lessons to figure out how you can take the information, improve what you're doing now, but also incorporate it into what you do in the future for other events that will happen. Make it realistic. When you talk to leadership and try to engage them, make sure it's realistic. For instance, if we have an Ebola outbreak, health centers are not going to treat those patients. We need to know how to triage remotely. We need to know how to recognize. We need to then know what we do, but we don't need to prepare to manage the care and treatment of individuals who are suffering from Ebola. So making sure that we stay in our lane, find that lane and stay in it. We also need to make sure that we avoid drama. It's really easy to lean into drama and inadvertently use fear tactics to really highlight how important this is. You're going to get to a point where you're going to overwhelm people when they see things that are just far larger than we can plan for or far larger than we can manage. They're going to turn off. So make sure that you keep it very realistic. And we all have plenty of examples beyond COVID that we can bring out of things that have happened in our communities in the past that we can use to really reinforce the importance of ensuring that we are engaging in emergency preparedness. Look at what your sister health centers are doing. There are some amazing, amazing preparedness activities that have been done and continue to be done. So make sure that you use the wonderful work that's being done as a model for what you are doing or need to do. Also talk to your partners. There has been incredible ingenuity and creativeness and effective efforts happening across your communities. Learn about that. Learn what they're doing. See if there's something that would make sense in your organization. But again, use this information to reinforce why your health center needs to engage in this and engage in a way that truly is meaningful. As much as we'd like to, we can't do this overnight. We need to take time to make sure that things are done in a thoughtful and truly integrated way. One thing I will say, because it happens here, I'm sure none of you have ever experienced this, but it's really easy to walk into somebody's office, talk about how important it is, and essentially delegate the activities upwards. Try not to do that. Sitting in my seat, I have 35 other things on my desk that I need to manage. If you can't come into my office with resources, with solutions, with ideas, and frankly, with offers to help, it's going to be a lot harder to truly engage and undertake these efforts in a way that is timely and in a way that is truly meaningful. So make sure that you walk in with offers and resources and not just imperatives. We're already doing so many things that it would be easy to weave EP emergency preparedness into. So every day, I know all of you are looking at ways to ensure that you are maintaining that patient access. Think about that from an emergency or a disaster standpoint. We already have, right? We've talked about that a lot during COVID. There are other events that would impact patient access. We've largely figured out how to maintain access for our patients. We implemented, not we as Southwest, we as health centers, we as the healthcare system, we've implemented remote services to make sure that we kept that relationship. It didn't replace our face-to-face relationship, but it ensured that we could at least stay connected and continue to provide care in the face of unprecedented situation. But that can be looked at from other types of disaster. How do we continue that to make sure that regardless of what happens, we can continue and maintain that patient access to the services that we know our patients need. And in some cases, it might be thinking about whittling down the care that we provide so that we can really focus on just those services that are critical. We need to build relationships in our community all the time, and we work really hard at doing that. So as you're building those relationships, keep EP in the back of your mind. How can you weave that into the relationships that you have? Again, as I mentioned, you never want to get to know somebody for the first time when you're standing in the midst of a disaster. We all work really hard to make sure that our organizations, our health centers, can keep our doors open. That is something, again, as I spoke about and we'll speak to later, we need to build into our budgeting process so that we have ways to support it and we have efforts embedded into our efforts to ensure that we can keep our doors open. And lastly, we're all working so hard on things like risk management and QI. This is a perfect complement to that. Certainly, emergency preparedness is a way to mitigate some of our risks. And when we find areas where we can improve, we can absolutely slide that into our QI activities. So in that way, you're kind of getting the opportunity to do one activity and get credit for 3 areas that you have to do. Lastly, as I mentioned, you need to take your time. This is something that can't be done overnight. And to really, truly do it in a way that will be effective, it needs to become a part of your daily business. So think about EP from every perspective and make sure that it's not something that's a switch that you flip on when something happens, but it's something you're thinking about regularly to make sure that these are activities that you're ready and able to take easily and quickly. All right. It's all about maintaining that priority and then funding it. At the end of the day, when you think about it, if leadership, whether it's within the organization or at the board level, isn't engaged, your efforts won't be anything more than a check the box, right? You say to HRSA, yes, we have an emergency management plan. Yes, it addresses these areas. But if you've taken a template and simply replaced the areas that say, enter your health center name here with your health center name, it's not really going to support what you need it to do. So make sure that this is a priority. It doesn't have to be the top priority all the time, but it needs to be something that has been deemed worthy of the resources that it takes to do it right. One of the ways to do that is keep it on the radar. Make sure that this is a conversation that happens over and over and over again. I know that we've all been talking about COVID ad nauseum for the last 2.5 years. That's not the only thing we need to worry about. So make sure that as you continue your communications with your board and your staff, that you include emergency preparedness items in that. In Connecticut, we worry a lot about hurricanes, especially as of June 1, all the way through the end of November. We talk about that regularly. We make sure that people are thinking about it and that they are putting in their own preparedness plans, because we can't do anything if they're not able to come to the health center to serve our community. We also include emergency management areas within our SWOT analysis as we put together our strategic plan. That is absolutely a threat across the board. So we identify those things that we feel are absolutely the most likely to happen in this area and would have the largest impact on our health center as well as on our population. Funding. So this is something that the CFO here at Southwest always likes to talk about, and we have to make sure that we get buy-in across leadership. So one of the ways that we've done it is to include emergency management in our annual budget. We track it separately. We have a dollar amount that we have identified as being able to support our efforts. So one of the things that you have to do and have to consider is who's going to do this? Somebody has to, or some buddies have to do this. So we use this fund to support partial FTEs of a number of different staff members. Some of you might be large enough to have a full-time emergency manager, and that's great if you do. For those of us who don't, we have pieces of really relevant staff, our COO, our facilities person, human resources, because a lot of this impacts our staff, as well as obviously our clinical staff. We develop an annual training plan, and we include this in this EP budget. This is something that we absolutely make sure our staff are aware of. Sometimes it's just dedicating some time to be able to do this, and that has, of course, a pretty big impact. When you're not seeing patients, you're not earning revenue, and that has to be accounted for in your budget. Sometimes it's bringing in consultants to train us or to manage the drills that we all need to do. Lastly, we use these funds to purchase the supplies and equipment that we will need to respond. It's easy right now to give examples around COVID, but we also need to have things like response kits, so that if something happens, our staff can grab and go to wherever they need to have at least the very basic supplies to be able to manage a patient who may have been injured. Think about building EP into your infrastructure when you're building new buildings or renovating existing. Things to consider would be generators, looking at enhanced HVAC or negative pressure rooms. It's much easier to include these when things are already torn apart or when you're building them up than to retrofit. And lastly, there are dollars out there. They're not always easy to find. Right now, they have been. Thank you to the federal government. We all have been supported very well. But there still are other avenues for additional funding. Look at your insurance carrier. Some of them will have grants that are available to support pieces of your emergency preparedness. Foundations, you can often weave emergency preparedness into other opportunities to make sure that you have things to support that continual service to your population. And sometimes there are grants available through either your state or federal agencies not related to pandemics. Make sure you identify those, have a plan, and apply to make sure that you can bring in as many resources as possible. And I think that's it. That is it. So we have some time for questions. I'd love the opportunity to learn from all of you. Many of you are doing this and doing it really well. This is an opportunity for others to learn and certainly for me to learn. There's always opportunity to improve what we're doing and how we're doing it. So please drop it in the chat box, raise your hand so we can unmute you, but would really appreciate hearing from those of you in the audience.
I'll pose a question to you, Molly, actually, and this is not scripted, so hopefully I do okay. I'm wondering, you know, we talked about a lot, well, let me put it this way. A lot of clinics have similar needs in terms of planning, preparedness, and want to share best resources. Is there a venue, a forum, a community of practice that you would advise people to take a look at, places where you can find templates and other kind of tools to aid in the preparedness process, even in a resource constrained environment?
Absolutely. I would start with your PCA. They have folks who are expert in this area. They understand the landscape. They understand the players within your state. Make sure that you start there. There are wonderful resources from most of your states. You've, of course, got the government federal agencies. However, I will say that sometimes those are higher level. We really need things that apply to health centers. And it's very easy to find yourself in resources, whether they're conferences, conversations, whether they are absolutely resources that you can modify. They tend to focus in healthcare levels that really aren't appropriate for health centers. So make sure you find things. You know, you can get things on the ambulatory care level, but they are often for private practices. It doesn't really impact what we're doing. So make sure that you're looking around locally, state level, and also, you know, you can type in resources and you're going to find more than you know what to do with. I also find ECRI to be a really helpful resource. NAC is a wonderful resource. So there's a lot out there. It's just a matter of really kind of culling through the information and finding that which applies to you and applies to community health centers.
Great, thanks for that. I'll go again. I'll do this all day. I could do this all day. And thanks to everyone for putting your locations in the chat. Megan Peck just commented that the healthcare coalitions also typically have funding for special projects. Your reaction to that, Molly?
Wonderful comment. Absolutely. Because at the end of the day, and I've said the end of the day, clearly I'm looking forward to the end of the day. But in reality, the health centers are a huge part of the healthcare infrastructure. Again, we have to make sure we stay in our lane, but by staying in our lane, we support other response actions from other members of our healthcare community. So if we can stay open and treat the patients who need services on the primary care level, we free up capacity in hospitals. So we have to make sure that we're working in that healthcare coalition, however that's defined in your state. And there absolutely are resources available, because the better we're able to maintain our services, the better they're able to respond and maintain their services.
That's great. I'll give you another question. The chat's very active on locations, which is great. We have people from everywhere. The question I have for you is, what is the role for a community health center in preparing your patients as well? I know this is a bit outside the scope of our conversation today about individual clinical preparedness, but are there actions that community health centers should look at? Are there resources they should be providing their patients? Because again, with appropriate primary health care and everything else, keeps patients out of those secondary and tertiary care centers and lowers the cost all around. And I think that there is some individual aspects of that as well. So again, not scripted, so apologies if I put you on the spot, but I'm eager for your thoughts on that.
I think there's a number of ways that health centers can help their patients prepare for and weather events. Number one, supporting patients and discussing the importance of having individual emergency preparedness plans. Stockpiling may not be realistic for your patients. They may not have the funds to support it. They may not have the houses or the areas to store the items. But making sure that at very least they have a communication plan, so that if something happens, they know who to call, they know how to reach that person, they have a meeting spot. Working with partners is a great way to make sure that we also can support our patients. Although it may not be preparedness on their end, we have to make sure that our preparedness efforts aren't just directed at our services, but are directed at the resources that our patients need. So for instance, we've worked a lot with homeless shelters to make sure that they have access to our services and support them in any way that we can, so that those who need those resources that we don't provide can access them elsewhere. We also work closely with soup kitchens and feeding programs, making sure that we have those close relationships and then can lead our patients to those services and resources that are so needed is critical. We also worked hard, and I know that this is something that we all did across the health center world, to provide home test kits, to provide masks, to provide hand sanitizer, things that we can offer our patients so they can implement those kinds of preparedness activities into their own plans. So I think also just knowing about the kinds of things that may impact us and some of the response activities that they can undertake, understanding what tornado watch versus tornado warning means, understanding when it's time to evacuate, knowing where to go when it's time to evacuate and how to get there. It's simple if you have a car and you speak English and you have access to televisions, radios, etc. Think about our patients who don't, and really focus on how we can prepare them to access this information so that they can protect themselves and their loved ones.
I think that's great advice. I was really interested about community partners of other organizations in wildly different sectors. You mentioned homeless clinics and food banks and even probably a lot of faith-based organizations as well, who provide support, especially in time of emergency, and ensuring that that information is flowing between all parties, I think is really interesting. We talked a little bit about individual patients preparedness, and the questions are on this screen, so the chat's on this screen, so don't mind me kind of looking off to the side. We talked about patients. We talked about the clinics, obviously a lot, internal preparedness, but with you bringing up, community resources, are you finding in your experience that there are ample opportunities to touch base with these other community assets, these other community organizations? Or is that something that a community health center could take a certain amount of leadership on as well, to invite the different stakeholders to a table and have these discussions about what happens in an emergency, who does what, and, as you say, not handing out your business card in a disaster?
I think it depends on your community. For instance, in Southwest, in Bridgeport rather, we lost our health director in March of 2020. And all of a sudden, we found ourselves in the very beginning of a pandemic without a director of public health, and we had to step in and figure out what it meant for our community, for our patients. We didn't play the role of a health department, but we had to find other sources of information. We had to forge some of our own paths because we just didn't have the resources necessarily at the city level. So I think there are opportunities to take leadership on this. The other thing I would say, and I spent a lot of time when I was at NAC and at the PCA before that, of really inviting ourselves to the table. When we learn about things that are going on, if we're not invited, reaching out to say, we want to be a part of this. And my experience has been that health centers are absolutely welcomed with open arms, because we bring resources. We have to often define what those resources are. For instance, we had an emergency drill in Connecticut many, many years ago, and the topic was a nuclear disaster. And the next thing we know, our state partners were talking about health centers being part of the decontamination process. Well, we don't have the resources for that. That is not something that we're going to be heavily involved in. So making sure that when we come to our partners, they know what we can do, and they look to incorporate what we can do into their plans. So sometimes you are lucky to be in a health center, in a community that truly values and understands what you do. Other times you need to be that spokesperson. I used to go to national conferences around emergency preparedness and always joked that we needed a flag that said, and health centers too, because they would talk about things and they would completely forget about us. And we wanted to wave that flag to say, yeah, we can be a part of this. We should be a part of it. And in reality, we're going to be a part of this. So let's have these conversations now so that we're not floundering and we don't have a situation where those who have a softer voice, or perhaps in some cases, no voice at all, are being left out of the response and the planning that needs to occur in order for their needs to truly be met when something happens.
That's great. We have a question from Tevin Leary, who says, what is the most creative way you've seen a health center do emergency preparedness?
Oh, that's a great question. In my experience with NAC, I saw a lot of great examples of this. I think my favorite is a health center in rural California. And they were co-located with a community center. And during the wildfires, they were surrounded by the fire, and they were in a very precarious situation. They served a very rural population, and a lot of those folks had farms, had a lot of animals that they looked after. And they found themselves in a situation that not only did they need to utilize the community center to house folks who were in immediate danger from these fires, but they had to create an environment where they could bring in these animals. So they had not one, but 2 packs of wolves. They had horses, they had cows, they had a lot of domestic animals. So they found a way to do that in a safe environment. I know it wasn't easy because you have a lot of territorial animals in that case, but they were actually able to really expand their scope because that was what their community needed. And they had the expertise, and they had, luckily, the space to be able to do that. But I loved the fact that they didn't just focus on humans. They looked at it much more broadly. And they didn't, in that case, really just think about the immediate healthcare. This was still in their lane, mostly, in terms of providing the support and the comfort for their patients. But they did it with such flair. And to me, that was always one of my favorite stories. The other thing that I'll mention, during Hurricane Katrina, there was a health center in Mississippi. And as you all know, the infrastructure was just wiped out. There was nothing in some of these communities. And they still had patients that required life-saving medication. The need for their insulin and the need for their blood pressure medication didn't go away just because they couldn't get those resources. So they actually took over a local baseball park, and they set up a makeshift pharmacy in the concession stands, so that you would go up just like you would during a Yankees game to grab a hot dog. Instead, you would go up to grab your medication. And it was something that everybody knew where it was. There was plenty of parking. They had security mechanisms built in, and they had a place for their staff to operate to be able to do this. So that was a really fun example of how health centers can be so creative. And really, again, we're scrappy. We're all about our patients, and keeping our focus on our patients creates innovation and allows us to do things that sitting here today, we might never imagine that we could do.
And with that, that's a great place to, I think, put a pin in this conversation. That will be ongoing. And I hope this was very useful for our attendees. I want to thank Molly so much for lending her time and talent and experience to this. Please do visit healthcareready.org. We'll have more of these webinars in the future. And again, thank you all so much for attending. This was very, very interesting, and I really appreciate your time. Thanks everyone.
Happy preparedness.
Happy preparedness.